Hi, I'm here with Anna today, who graduated from URI in 2018, and since then she's had two different pharmaceutical jobs. She started her career as an analytical scientist, but about 8 months ago got a new job as a quality control analyst of medical devices at Vertex Pharmaceuticals, and they're currently developing medical devices to cure type 1 diabetes. Thank you so much for being here with me, Anna, today. I really appreciate it.
Oh, thank you so much for having me.
Of course. First of all, can you tell us a little bit about what you're doing in your career at the moment and how you got there?
Sure, yeah. So this is my second job here, and I got here honestly because there was a new opportunity from my last job. I had done a lot of analytical work and I wanted to do something different, and Vertex was giving this great opportunity. It's a great company, and I'm literally helping to cure type 1 diabetes, which is incredible. It's just so wholesome, and the people have been incredible to work with, and really happy doing that at Vertex. I work in quality control, so I'm actually inspecting our medical devices and then moving them through to the next output.
So can you explain a little bit what it's like working as a quality control analyst on a day-to-day basis? What does that look like for you?
Sure, yeah. So I work at Vertex in Providence, and Vertex is actually located, they have multiple locations, but the one in Providence specifically is working on a medical device to help cure type 1 diabetes. So I'm actually like right in the middle of doing all of the testing for this specific device, which is really cool. So it's a very new product, and what I have been doing is kind of almost taking apart this device and testing different pieces of the device in different ways, making sure that it's the most effective and safe form for this device. And then once we get the results, I will either like pass or fail it depending on our visual inspection criteria. And once I pass or fail it, it'll go on to packaging and to clinicals and hopefully, into patients. That's more down the road right now since this device is very new, but I'm rarely ever sitting at my desk. It's not much paperwork. It's very much in the lab, and I'm really hands-on, and it's really a great opportunity I found.
It really sounds like you're having a direct impact on that product. So that way you're making a big impact in the field, I think.
Yeah, it's crazy. And it's really right in the middle of it, which is just wild to me. I'm very happy where I found this job.
That's really great that you found something that you're enjoying so much.
What would you say your favorite thing was about the BSPS program?
I really liked, at the time it was a much smaller knit, close group, and the fact that you kind of knew everyone and could make these connections was really great. It wasn't too big, and you kind of were all in the same boat with everyone. You were all taking the same classes, which they still are now, but I really liked that you could kind of just talk to anyone in that program, and they were all kind of in the same boat as you, and it was just really easy to kind of make those connections and help each other.
Yeah, definitely. That's still I still can relate to that. I think that although the B.S.P.S program has grown probably since you were in it, we still are one class size, so there's not multiple classes, and so we take the same classes. We'll go from one class to the next class with the same people, and we all get to know each other really well. And I think that's what you're touching on, that we are a community, and it's nice to be able to relate to everyone really well when you're all stressed about one assignment or you're all happy about a certain grade. It's nice to have that community within the URI community as a whole. It's definitely unique to the program.
Yeah.
So I know you're involved in an internship while you were at URI. Can you tell us a little bit about how you got that internship and what it involved, and how you kind of balanced that with the BSPS program?
Yeah, definitely. So being in the BSPS program really helped me get this internship. Erin was super helpful, and she kind of guided us along the way. And there was other people that were able to kind of help you in that class find these internships. So I started off in this internship. It was part-time, and I was doing it while I was taking classes. And what they were doing at this company, they had designed this model to kind of print 3D drugs. And it was really unique. They were almost an engineering company rather than a pharmaceutical company. So the printing of the drugs that they were using was just kind of to show how well their 3D printer was working. And they kind of described it as like frosting a cake almost. So they would just kind of, the instrument would just like frost drugs and they would be 3D printed. And so I spent a lot of time kind of going through like SDSs and making sure that they had the right consistency of the drugs, and they would reformulate them and just kind of perfect their equipment rather than perfect the drug itself. So that's kind of what I spent most of my time doing.
That's a really interesting and unique internship. And I think that 3D printing is, you know, an up and coming field within our industry. And as you mentioned, this company was using it to print drugs, but we have powder-based 3D printers here in the College of Pharmacy. And under Dr. Cho, you can participate in individual projects, 3D printing molecules that you can model using software, and then you can 3D print them and have a physical model of that, whatever molecule or protein you want to print. So it's an opportunity for students to learn a skill that I think is definitely going to be desirable for you know, employers in the industry in the future, because it's only going to get more useful, I think, for this field.
Yeah, I agree. It was crazy. I hadn't seen anything like that before, so it was really cool to experience.
Yeah, it definitely is. And you just touched upon there getting the internship while in the program, and you mentioned Erin Edmonds, who's our experiential education coordinator, and she does a phenomenal job helping us with internships and then jobs, life after URI. So whether that be grad school applications, job applications, she helps you with cover letters, resumes. She is amazing, and it's a really invaluable resource that we have here in the BSPS program.
Yeah.
How would you say that the BSPS program prepared you for either your current job or your first job?
I would say that a lot of the networking and the opportunities really helped me prepare for my first job, whether it was like honestly just the classroom, the hands-on experiences that we did through the program, and the internships at URI, along with the research, the undergrad research labs that are available. Those all kind of helped me gain the experience, not necessarily like with exactly what I'm doing now, but kind of just help me get my foot in the door, help me build a resume, and then help me get a kind of an entry level job.
Yeah, I think that is really key what you touched upon there, that the opportunities that we have here are key to building up a resume, and that's the thing, we get such a broad experience of kind of all of the different aspects of pharmaceutical science as a whole. Yeah. What advice then finally would you give to BSPS students, maybe they're sophomores or juniors, regarding the opportunities that are available to them here in the College of Pharmacy?
I mean, I would say there's just so many opportunities. Take any opportunity that you can get. It's a lot of work, but it definitely pays off, and I wouldn't have done it any other way. I mean, I did internships and undergrad research, and it definitely helped me get my first job. I mean, even just as we mentioned, building a resume, it really helps, and I would highly advise going for those opportunities as an undergrad.